Even though the core principles of humanitarian aid remain the same, the sector has, with the development of new technology, evolved greatly and adopted many innovative approaches. One such approach is anticipatory action. While aid has historically been reactive, responding to crises after they have occurred, anticipatory action predicts humanitarian disasters and works to prevent them. Lisa Doughten, the Chief Director of Finance Department at OCHA, offered insight into anticipatory action.
And I guess another thing I was wondering was, how is finance related to anticipatory action? Can adequate funding prevent crises in advance?
Yes, absolutely. And thank you for asking that question, because anticipatory action is something that we at OCHA have been working on for a long time with other partners who have also been working on it, like the International Red Cross, Red Crescent movement. And that's really trying to address the need before it happens, because it's much more cost-effective, cost-efficient when you address the needs before they happen. Because if you have a flood, you're going to have to potentially airlift supplies, either by helicopter or by airplane. Or you pre-position. If you pre-position the supplies in advance, whether it's water purification tablets or seeds and tools and other things that you need, if you pre-position those, transportation costs are a lot less. People have things when they need it, where they need it. And so what we've been doing in OCHA, about 70% of the anticipatory action has been funded by this global fund I mentioned, the Central Emergency Response Fund, or it's called the SURF. And so we find that if we work with the communities, we listen to what they need, we pre-plan the partnerships, and then we provide the funding. So as soon as something happens, if there's a trigger saying if a river rises to a certain level, then there's a trigger that gets hit, then the funding is available immediately to the partners for the pre-arranged programming. So it really works quite well. And in one case, within 14 minutes of the floodwaters rising, our funding was released to the partners and they had it in their bank accounts within 14 minutes.
Wow. Beyond innovations in methodology, humanitarianism today has vastly expanded in scope and scale since Dunant's time. Aid in the past was divided and disjointed. Different organizations often carried out the same actions or overlooked areas of need, leading to inefficient resource allocation and even failed efforts at times. In recent years, however, these scattered initiatives have joined together.
Joyce Msuya shared her story on how different organizations collaborated to provide an educational, health-based, and developmental solution for the children of displaced families from war zones in Yemen.
Entities within the United Nations, but also outside, for example, NGOs, friends, but also international financial institutions to provide basic services. I remember one of my trips to Yemen, which is a war zone. I visited a project sponsored by UNICEF and a local NGO that had schools for families that have been displaced from one part of Yemen to the other because of war. But children had schools, they had a play area, like a playground. And I was talking to young children for their own mental health. They were doing some art projects to basically distract them from the conflict around them. And I talked to the teachers. Most of them were volunteers from the community. So education is definitely one. The second is good health. Their health facilities, are they enough for most of these crisis-stricken areas? No. But organizations such as WHO, the World Health Organization, local NGOs, they're working to actually provide basic medical services like immunization, so children could just be healthy to be able to go to school. And then, of course, you have what we call the development partners, the agencies, organizations that build schools, build hospitals, infrastructure for the families.
Msuya's story opened our eyes to how much the scale of humanitarian aid has grown. This type of collaboration exemplifies the cluster system the sector has established in recent years, an effective and targeted solution to complex issues. The scope of modern aid is far beyond simply treating wounded soldiers as it was in the past. Now, it's about rebuilding foundations for generations of lives to come. Compared to the past, the most significant advancement in humanitarian aid today is communication. The unprecedented scale of global collaboration between different organizations relies on this capability. In addition to coordination within the humanitarian sector, communication with affected communities and the public is equally crucial for successful aid.
Listening to what people need. It's something that's emphasized both in Mekki's field of communication and Lisa Doughte's role in partnerships.
How do you think humanitarian action has evolved since its past efforts? And what factors do you think will define it in the future?
It used to be that humanitarian agencies would be present in certain countries or settings or circumstances, and they would be, okay, here's what we need to give to people who are in need. This community has been affected by a drought. We're going to give them, going to give them seeds, or we're going to give them water, or we're going to give them tents so they can live in tents. We're going to build latrines for them. There wasn't much of a deliberate effort to sit down, to talk to members of that community and say, hey, tell us what you need and tell us what you expect from us and how we can help you.
Work with the communities. We listen to what they need, which is a more dignified way of providing the assistance. Have the conversations, ask the right questions, and I think that's key to really understanding. It's not going and thinking you know what's happening. You don't know exactly what somebody thinks. And if I may just give an example, when I was in Central African Republic a few weeks ago with this donor trip, one of the major projects that we have there is called Accountability to Affected People. And so one of our funds that we manage on behalf of the system provides funding for people to go and listen, to sit in a community group and say, what are the things that you still need? Are you getting what you need? And what I heard were women saying, we need to have the hospital fees paid so we can have a safe childbirth, because we can't have that in this displaced persons camp.
So that's the shift that's been taking place over the past few years, and a bit, more concretely recently. In OCHA, we have something called the Flagship Initiative, which is something that we launched just last year as a pilot for now in 4 countries, the Philippines, Colombia, South Sudan, Niger, where we are deliberate in going to the communities, to outside of the capitals, outside to the deep, what we call deep field sometimes, like to the most remote area that you can think of. And we sit with the communities and we say, we're here to help, we're here to listen. What do you need? And then based on that, we provide that need. That's the evolution that's taken place a bit modestly, but that's the evolution where I think and I believe that the humanitarian system should be going.